Hello, I'm Dr. Ryan Flannery, and I wanted to take a little bit of your time today to talk about COVID-19 infections and specifically talking about COVID-19 vaccines that are on the horizon very shortly. You may have recently received an email or correspondence from the hospital asking if you wanted to be interested in being a part of a COVID vaccine availability when it's offered by the federal government. And I think before you can make any of those decisions, you have to understand a little bit more about the vaccines themselves, as well as the vaccination plan that's being rolled out by the federal government. First of all, let's talk real quickly about why we need to know this information now. So there is a National Vaccination Plan that's going to be happening with whatever vaccine options are going to be available for COVID-19. And as a part of this plan, they're trying to stratify who needs the vaccines first to try to get the best protection for individuals to begin with, and then rolling it out to the general public from there. So it's a phased plan. So you can see that there's three essential phases. There's the first phase, which is broken up into two parts. They would like to get people who are healthcare providers and work at healthcare facilities as one of the first options of patients to get these vaccines to give them protection from getting COVID-19 infection. And as a part of that phased approach, all the other individuals that are also deemed essential workers, police, EMS workers, people that work in the school systems, people that are in the nursing homes or in group home settings, or even adults that are over the age of 65 that have high-risk medical issues that put them at risk with COVID-19 infection. Those are the individuals the government realizes needs to get the vaccines as soon as possible to start to give them protection, okay? The other phases, which will be rolled out over months after we start the vaccination program, are going to be broken down into the general public and then potential other categories of patients like pediatric aged patients or patients that are pregnant. Those are individuals that maybe we don't have as much information with the vaccine trials to know how these vaccines are going to work in those populations. So the question that you need to ask is, so what are these vaccines all about? I mean, why do I want to choose to do a vaccine now against COVID-19? So I want to first of all talk about COVID-19 itself as a virus. So a virus is an organism that only lives in a host, meaning that when you have a virus that gets into your body, it actually goes into your body, into your cells, and takes over those cells in your body. You become the host. And the virus, and this is the virus that I took a picture of, or made a picture of here. So they refer to it as SARS-CoV-2. So it's the virus that causes COVID-19 infections. This virus gets in your body, in your cells, and what it does is it takes over your cells and it starts to produce more virus to cause an active infection in your body. So the whole goal of the virus is to take over the host and to wage a battle to make more virus to actually then cause you to get sick and cause more virus to be produced so that you spread it to other hosts, other people, that continue that spread going forward, okay? The interesting thing about this virus, it's a new virus. No one's ever had this around or exposed to before the pandemic started earlier this year. We know based on genetics of viruses, based on just the genetic makeup of these viruses, we know that these viruses have a very unusual protein on the outside called a spike protein. And this is really important because this spike protein does two things. It's how the virus, when it gets into your body, gets into your cells. And as it produces these viruses, it makes more viruses with more of these spike proteins. The interesting thing is the body realizes that these spike proteins are not normal for your body. So your body knows right away when it starts to sense these viruses in your system and they sense these spike proteins, it forms what's called an immune response. It causes your body to say, there's something in my body that shouldn't be here. I want to fight it off and get rid of it. So that's when your immune response comes in. So your immune system is full of a bunch of cells all over your body. And there's two big kind of classes of cells in a brief overview. There's something called T cells and B cells. The T cells are like the brain of your immune system. They fight off the virus by killing cells that these viruses live in, and also kill off the viruses themselves. So once your body realizes there's an infection going on, we need to do something about it, these T cells go into effect to cause them to kill off the cells that are infected, as well as killing off and getting rid of the virus. But it also starts to form what we call memory cells. And this is really important because this is how you can retain memory in your body so that your immune system can fight off this same exact infection again if it gets exposed to it down the road. It's how we can overcome certain illnesses and never have those illnesses again, because your body's making memory cells. And these memory cells are important because that protects you going forward. The B cells are another part of the immune system, and they create antibodies. And antibodies are just proteins that basically can start to attach themselves to any foreign object. And in this regard, it's going to attach itself to the virus. So the antibodies will come and actually recognize these spike proteins, for example, as a foreign thing, and the antibodies start to glom onto it, start to kind of cover it all up to get rid of it from the body, okay? So both of these immune responses are important to get over the infection and then to make memory cells and memory antibodies that prepare you for another battle down the road if you get infected again, okay? So that's kind of a brief overview. So the virus is trying to continue to grow and replicate to spread to other people. That's the virus's goal.